Eitan, do you hear me?
ערב טוב, מה שלומכם?
Erev Tov, how are you?
תודה בסדר, תודה בסדר.
Okay, so first of all, thank you very much for joining. We have prospective students in here and also students from the September course are joining. How are you?
Very well. We've had some amazing success lately in Israel. Much of it because of the work of yourself and your team. But we are so pleased with what happened. We were in Israel אנחנו היו בארץ, last week with a team of my professors, my colleagues, at hospitals, at Meir, at Schneider, at Bellinson, at Hadassah, Kaplan, Asaf Rofer, and more and more and more and more. And we've signed contracts with them, for our students to be able to do clinical rotations. We had a wonderful meeting with the Ministry of Health, and the head of the finance about the Afikim program, how it's starting next year and the progress for it. And about recognition without, actually, maybe this is the secret I'll say for later on. Other good news for all our students. So it's been really, really wonderful. And it's very warm to see how much love there is here in Prague for Israel and for our Israeli students. As a lot from me, how to say it from me?
ממני.
בשבילי. זה מכל החברים, הפרופסורים מפה מפראג.
Thank you. It's been a pleasure having you here. And I think that we did a lot of progress. Can you tell our students a bit about the possibility to do clinical rotations in Israel?
So firstly, you have me here, you have me for as long as you want. And you'll hear me repeat again and again my first rule to all of you. My first rule is all questions are good questions. There is no such thing as a silly question. So let's do a question answer. Let's have open questions discussion here. Prague, First Faculty of Medicine, Charles University, Charles Echad, Ba'aretz. We are one of the oldest medical schools in history, the 10th oldest medical school in history, ranked in the top 1% of all medical schools globally. We maintain our reputation as being one of the top universities, medical schools in the world. And we maintain that also because of you and because of people like Yotam, who's joined us here, who excel in their studies and excel in the USMLE. Was it 3 years ago we had, in fact, for the last 3 years, we've beaten Harvard every year with our results in USMLE. So we have a program which we created in conjunction with Dr. Cohen and his team, working hard with Israel and the Israeli government, and with Clalit and with others, that the first 3 years of the program, theoretical years, that those years where you learn the foundations of knowledge, of information, which will stay with you for life to make you into the ability to become a great doctor, where you'll grow your clinical knowledge from. Those you'll do in Prague, in English, in Prague. Then in the clinical years, we start doing clinical practice earlier, but the pure clinical practice starts from about halfway through the 4th year. So what we've created now with contracts with Israel, with Israeli government, with these hospitals, both government hospitals as well as Clalit hospitals, the whole Clalit network, is that your final year can be done at any of them. In the 5th year and 4th year, certain clinical rotations, the amount of time you can also do in Israel, either at Hadassah, at Hebrew University, or in certain other locations, from the clinical subjects the 4th year onwards, so halfway to the 4th year onwards. There will be subjects which you will want to do in Prague. There are things in Prague, even with the amazing hospitals we have in Israel, there are some things which Prague is ahead of the world like proton beam therapy. Proton beam therapy, I know from Britain, from London, where I'm from, we've been sending patients to Prague for more than a decade because we didn't have this in the UK. And we bought the technology of the proton beam therapy from Prague to Britain. So there are certain centers and certain specialties where you will want to do in Prague because it's better. But we want you to also gain the clinical skills, which don't just mean physically doing something on a patient. It means communicating with a patient. It means understanding the healthcare system in which you are working. And for that, you need to be in the country in which you wish to work. And it also aids you in making connections, getting those hard-fought rotations, the jobs for the specialization later on in your career as well. So the hospitals have all agreed you will be taught alongside the Israeli students in one of two ways. We, first faculty, do not accept you being taught in second shift, like some other universities might say, oh yeah, you can learn second shift. That's not acceptable because you are not second-class citizens or second-class students or anything else. So for us, we only accept you being taught predominantly in normal, like any other Israeli student studying in Israel. We want you to experience second shift. We want you to experience night shift and the evening shift because that's an integral, vital part of your medical education, to know what life of a doctor is. But your main education will be given either in groups alongside Israeli groups. So when when 1 week will be the Israeli group taught, and then the next week will be the Czech group, first faculty taught, or 6 weeks here, and then the 6 weeks of Czech group, or with places like Hadassah Hebrew University and a few others, they want you integrated with their students for what I call cross-pollination of ideas, of knowledge, of experience. You will gain from the Hebrew University students' experience, they will gain from your experience. And when we met with the CEO of Hadassah and Dean of Hebrew University last week, they specifically said they want you, our students, to be in with the groups with the Hebrew University students, which I think is a wonderful thing. The different hospitals vary according to what their capabilities are. So, but you will be taught during the daytime and have it all arranged by our faculty. We have a specific person whose sole job is to do the logistics for you for these rotations.
Thank you very much. Yotam, can you join us?
Yes. Hello, everyone.
Hi.
Hello, Professor Brizman. How are you doing?
Shalom, Yotam. It's good to see you, my friend. How are you?
Likewise. I'm great. Thank you.
Tell me something, Yotam. Pediatrics are really excited about you.
Really?
I was speaking to the boss of pediatrics, and in fact, we had Professor Pavlo Pokorna here in Israel last week. Everyone's wanting to know, when are you starting in pediatrics?
Hopefully, I'll pass my Czech medical exam. I'm planning on taking it in December, and I really hope that I'll pass it. And according to the conversations I've had with my head of department, roughly 1 month after that, so probably January. I would say February the latest.
Amazing. They're very excited about you.
Thank you. I'm really happy to hear that.
So, Yotam, you can also approach, with the Eitan's permission, the students in Hebrew. Describe a bit about your path, what you did, how was it for you to learn to study in Charles University? You're a graduate of Charles I, and what made you stay in Prague? What made you stay in Europe and not return back home? Tell us about it.
Yeah, so Professor Brizman, with your permission, I'll switch to Hebrew just for simplicity's sake. אז מה נשמע כולם? אז שמי יותם אופיר, אני בן 29 וסיימתי ללמוד בפקולטה הראשונה לרפואה בצ'ארלס ממש ביוני האחרון. למדתי פה את כל 6 שנים שלי כשעשיתי סמסטר אחד בישראל בעזרת התוכניות של משה באסף הרופא. והלימודים בפקולטה היו מאוד אינטנסיביים אבל מאוד מאוד מלמדים. אני גם בא מאוד מתחושה שאתם באים ללמוד רפואה, אתם לא רוצים ללמוד בפקולטה שלא תאתגר אתכם ושלא תדחוף אתכם, לגרום לכם לעבוד. זאת אומרת, אתם כן רוצים להיות במקום שהוא בעל רמה טובה. יש המון פקולטות לרפואה בעולם שאתם יכולים לצאת משם עם תואר ולעבוד משמעותית פחות קשה, אבל במקצוע כזה זה לתחושתי לא משרת אתכם כרופאים לעתיד, ויש הרבה יופי דווקא בלעבוד מאוד קשה לאורך תקופה מאוד ארוכה. אז עברתי לפה ב-2017, והלימודים עצמם היו חוויה מדהימה. זה מאוד מוזר לחשוב על זה שעוד מעט מתחיל הסמסטר ואני לא מתחיל עוד שנה אחרי 6 שנים של לימודים, למרות שאני מתחיל את ה-PhD שלי במקביל, אז זה הסוג שונה של התחלה. ומשה שאל לגבי ההישארות בפראג, אז אני חושב שאם חלקכם תבחרו להגיע לפה, אתם תראו שהעיר הזאת והמדינה הזאת הם מקום נפלא ומיוחד מאוד. העם הצ'כי, אני חושב, נתפס בהתחלה לנו ללמוד כישראלים כאנשים קרים, אבל מאוד מאוד רחוק מהמציאות. הם אנשים מקסימים שמאוד מאוד מאוד אוהבים ישראלים, הם מאוד אוהבים את ישראל באופן כללי. וכחלק מהמסלול שלכם פה אתם תתבגרו ואתם תקבלו החלטות של אנשים בוגרים, כמו איפה אתם רוצים לבסס את החיים שלכם, וכמובן שמי שירצה לחזור לישראל זה הכי מובן בעולם, זה מה שרוב הבוגרים שלמדו בחו"ל עשו לאורך הרבה מאוד שנים, ואני חושב שמשה דיבר על זה הרבה בעבר, אם יצא לכם לקרוא לשמוע שכאילו המגמה הזאת משתנה בשנים האחרונות הרבה יותר לכיוון שאנחנו מבינים שאנחנו יוצאים עם השכלה ברמה מאוד גבוהה ועם תואר אקדמי שמוכר בכל האיחוד האירופי, וחברים טובים שלי שהם כבר לא חוזרים לישראל, נשארים פה או עוברים לגרמניה, וזאת אופציה שהיא הרבה הרבה יותר אמיתית מאשר שהייתה בעבר. יש לי גם פה זוגיות וגם פיתחתי פה חיים ומאוד מאוד נוח פה, וההכשרה הרפואית פה לא נופלת מההכשרה הרפואית בארץ מבחינת התמחות. זאת אומרת, בתי החולים פה ברמה מאוד מאוד גבוהה והם עושים עבודה מאוד יפה בלהכשיר רופאים. נגיד מחלקת נשים בבית חולים שלנו מובלת על ידי פרופסורית שנקראת פיטרובה, אני חושב שהיא אחת מהפרופסוריות הכי בכירות בעולם, פישרובה, אחת מהפרופסוריות הכי בכירות בעולם באונקוגינקולוגיה. זאת אומרת, זה כאילו top of the class, באמת highest standards שתמצאו פה. זאת אומרת, הסגל האקדמי הוא סגל מאוד מאוד טוב, אבל בתמורה גם צריכים לעבוד מאוד קשה בשביל רוצים להישאר, ובוודאי חלקכם כבר שמעתם שאומנם יחסית קל להתקבל כי אין פסיכומטרי, כמובן עושים מבחן כניסה, אבל המבחן כניסה הזה בשנים האחרונות נעשה מאוד מאוד קשה, והוא אמנם מכיל באמת רק ביולוגיה, כימיה ופיזיקה, אבל האתגר האמיתי הוא באמת לשרוד את הפקולטה quote unquote, את השנתיים הראשונות, שנה א' ושנה ב', שנים מאוד אינטנסיביות, שאני חושב שהרבה מאוד מהסטודנטים שנופלים לאורך הלימודים נופלים בהן, אבל מהניסיון שלי, ואני חושב שגם מהניסיון של הפקולטה, שהרבה סטודנטים ישראלים זה פחות נפוץ. זאת אומרת, הרבה סטודנטים שנופלים בפקולטה הם דווקא לא חבר'ה מישראל שבאים מאוד חדורי מטרה ומוטיבציה ובאים לעבוד, אלא חבר'ה שבאים קצת לבלות יותר מדי. אז טיפ חשוב, אם אתם מחליטים לבחור בפקולטה, זה לדעת שאתם באים לעבוד, ולעבוד הרבה. Brizman, I was just saying that I think the majority of students that flunk throughout the years are not Israelis, but from different countries, Dubai, etc., etc.
You said it beautifully, and Yotam, what we in the faculty know, as you said, I think as well, there's two things, in fact, which is interesting. When the the group of these heads of all the state exams, heads of obstetrics, gynecology, of surgery, trauma, of cardiology, endocrinology, gastroenterology, pediatrics were with me in Israel. It was very interesting that the hospitals, and we're talking about the top hospitals in Israel, said that their experience of yourselves, of you, Yotam, and your colleagues who did the clinical rotations in Israel, is that the first faculty students stand out because they are absolutely excellent. As good as, in fact, sometimes they would say better than the students who are trained in Israel. And this mirrors exactly what our colleagues know from Prague, is that our Israeli students, by and large, are the top students of every class of the year. We are very proud Of course, I may be biased, but we are very proud of our Israeli students, and they, by and large, all do extremely, extremely well. It depends, of course, upon the students to do the work. Yotam, as you know, we are not going to pass the exams for you. The students, or you're not a student anymore, you're a doctor now. When you were a student, you had to work very, very hard. And all of you, when you come and join us, you will have to work hard. You put the work in, you put the effort in, and you'll get rewarded for it. One thing I forgot to mention about the clinical rotations, which is new. But Tom, when you did the clinical rotations in South Africa and other places, you had to pay a fee to the hospital in Israel. So last week, the Ministry of Health confirmed that this will be no longer, that the hospitals will not charge any of our students a fee to do clinical rotations with them, that the hospitals can invoice the government, the Ministry of Health directly, and that will also include the indemnity, the insurance required for students, that the Ministry of Health will pay for our students, also that part for our Israeli students to do clinical rotations in Israel. So I think it's another big relief for the students. Because it could be quite expensive. It was up to 500 shekalim a week sometimes.
Yeah, I think it was, when I did it, was 150 euros a week. Yeah, so it was quite expensive. Yeah.
So
especially if you're doing 6 months or a year.
Ministry of Health is understanding more and more the importance of the students who graduate from excellent universities in Europe. Among them, of course, Charles University. We are very pleased with your visit, and we are very pleased with the meetings that you did. And we will, of course, distribute this to all students and show them. And this has a huge, huge impact on everything. Governmental level, parliament level, physicians, students. It was very, very successful also from the Israeli side. Eitan.
Thank you.